A bipolar person's argument for being off medication. Introduction. The personal struggle with medication. Living with bipolar disorder is a challenge, and for many people, the medications prescribed are seen as essential. They help stabilize moods, prevent manic or depressive episodes, and allow people to lead functional lives. However, for some individuals, the idea of being off medication can feel like a path worth considering. This argument is for those who feel the medication is doing more harm than good and why they might choose to explore life without it. Before we begin, it's important to note that this is not medical advice, but an argument from the perspective of someone who feels medication isn't the best solution for them. Always consult a healthcare provider for personalized advice. Number 1, the side effects of medication. One of the most common reasons someone with bipolar disorder might consider stopping their medication is the overwhelming side effects. Many bipolar medications, including mood stabilizers, antipsychotics, and antidepressants, come with side effects that are difficult to live with. These can include weight gain, blurred vision, cognitive dulling, tremors, and sexual dysfunction. While these medications may help stabilize moods, the price to pay in terms of quality of life can feel unbearable. For example, some individuals find it hard to feel mentally sharp or emotionally connected when on medication, which can detract from their overall sense of self. A person may feel emotionally flat or disconnected from their own thoughts and creativity, something they highly value. For many, the side effects of medication overshadow the benefits, and this can create a strong desire to find an alternative way to manage their bipolar disorder. Number 2, a desire for authenticity and self-understanding. Being on medication for bipolar disorder can sometimes feel like living in someone else's body, even if it is for the sake of stability. Medication often dampens emotions, and while this might prevent dangerous manic episodes or deep depression, it can also strip away the authenticity of one's personality. For a person who lives with bipolar disorder, a manic episode might be chaotic and risky, but it can also feel euphoric and inspiring. The creativity, energy, and rapid thought patterns during mania can lead to breakthroughs in art, business, or problem solving. Similarly, depression, while painful, can lead to deep introspection and insight into the human condition. When medications aim to flatten these extremes, some feel that they lose a part of who they are in the process. Living without medication might offer a chance to reconnect with those deeper parts of themselves, even if it means risking occasional instability. For those who are willing to accept the risk, the hope is that they can find a more sustainable, self-driven method of managing their mood. Number 3, life without the chemical crutch. Some people with bipolar disorder feel that being medicated for long periods of time may create a dependency on external substances, preventing them from developing internal coping mechanisms or resilience. They may feel that medication masks the underlying emotional challenges instead of addressing them head-on. Without medication, an individual may explore therapeutic approaches that are more focused on emotional growth, self-regulation, and mindfulness. Cognitive behavioral therapy, meditation, yoga, and lifestyle changes such as improved sleep hygiene and diet may offer long-term tools for managing mood swings. These methods might empower the individual to confront their emotions rather than dulling them, and allow for a more holistic approach to managing bipolar disorder. Number 4, the desire for greater control over one's life. For some, taking medication for bipolar disorder can feel like surrendering control to something outside of themselves. While the medication may be meant to stabilize mood and prevent extremes, it can also be perceived as something that takes away personal agency. Medications are often prescribed in a clinical setting, and often individuals don't have as much input in the choices of drugs, dosages, or the side effects they experience. The desire to take control of one's own health and to find balance without relying on pharmaceuticals is a powerful motivator for some. They may explore other options such as herbal remedies, acupuncture, or biofeedback therapy to see if they can find a better, more personalized way to regulate their moods. For some, the belief that they can conquer their disorder through their own effort and natural means is a source of empowerment. Number 5, the long-term effects of medication. Another argument against medication is the long-term uncertainty about its effects on the body. Some individuals worry about the potential for cognitive decline, kidney or liver damage, or other long-term health risks associated with long-term use of mood stabilizers and antipsychotics. These risks become even more apparent when the person begins to feel that the medication is no longer as effective as it once was. The process of adjusting dosages, switching medications, or dealing with breakthrough symptoms can be mentally and physically exhausting. The constant need to manage side effects, check in with doctors, and deal with the feeling of not being themselves becomes draining. A person may decide that the risks of long-term medication outweigh the temporary stability it provides, especially if they feel that they can explore other ways of coping that don't involve ongoing pharmaceutical use. A desire for better emotional awareness. When people with bipolar disorder are medicated, their emotions may be muted. While this helps to prevent dangerous mood swings, it can also impede their emotional growth. Bipolar disorder is, in many ways, an emotional roller coaster. While it's difficult, it's also a path toward greater emotional awareness and understanding. Some individuals want to feel all their emotions in their entirety, both the highs and the lows. They may see the challenge of balancing their moods as an opportunity for growth and self-discovery rather than something to be avoided at all costs. For these individuals, experiencing the extremes of emotion can feel like a vital part of being truly alive. They may feel that medication distances them from the experience of life, and that by learning to manage their emotions without external control, they can achieve a greater sense of autonomy. Conclusion: the choice is personal. The decision to be off medication is not an easy one for a person with bipolar disorder. There are significant risks involved, including the potential for manic episodes or deep depression. But for some, living without medication means reclaiming their sense of self, finding alternative ways of coping, and embracing their emotional range. It's important to acknowledge that each individual's experience with bipolar disorder is different. For those considering this path, it's crucial to weigh the pros and cons, seek professional guidance, and consider all available options. Ultimately, the choice of how to manage one's mental health belongs to the individual, and sometimes the path without medication may seem like the best choice for a fulfilling, authentic life.